One of the common pitfalls that M&E pitfalls that programs run into is that they sometimes try to get too ambitious too quickly, and they spend a lot of time developing indicators and coming up with complex M&E plans without really thinking through what it's going to take to actually operationalize that. So you end up with a lot of indicators, but not necessarily a lot of data that actually on those indicators, or very poor quality data on the indicators. So I think that's one thing that people get very fixated on the indicators rather than thinking through the whole process. I think the budgetary allotment of 10 to 15% that's often quoted, and it's a fairly arbitrary figure, but it's quoted a lot. It's probably not an unreasonable amount to put forward in many situations, but it is hard to carve that out in a very resource-constrained environment. So definitely it's challenging, and not all programs invest in that. But I don't think that's the only challenge. I think time is a major challenge. People are very busy. M&E is often low on their priority list. Their first priority, they're doing the program itself. You've got to have services. You've got to provide the program. Otherwise, there's nothing to monitor and evaluate. So their time is very focused on the actual service delivery, particularly in a situation where you don't have a dedicated M&E unit. Well, the advice I would give to a family planning manager who wants to implement an M&E plan or track results is to really think carefully at the beginning about how you want to use the data, what kind, or the information that you're going to get out of the M&E system, what kinds of decisions do you need to make, and that's not just about I need to report it to my funding agency, but even that's a valid use in the sense that it's useful in advocating for resources or in securing additional funding. That's the use of the data, not reporting per se, but thinking about really what you want to use the system for. And then a second piece of advice I think I would give is to start simple. Really think carefully about what your situation is right now, what your how much resources you have, and if you're a small program with limited resources, start with something simple, get it going and build on it. If you're a larger program and have more resources, then clearly you can invest in something larger and put more resources and more attention into the M&E. I think that most organizations in less developed countries do have the capacity to implement at least some minimal level of M&E if they have the organizational commitment and leadership to do so. But it may be very simple. It may just be a few qualitative interviews with clients to get a sense of services, or some very basic service delivery statistics at a really rudimentary level. So at that most basic level, I think once you get to more advanced systems, one of the capacity constraints is, other than having the leadership and commitment at the organizational level, can also be the individuals. It's hard to find individuals who really have the M&E skills. They are out there. There's some very good people out there, but they're in high demand, and so it can be hard to get those people, to attract those people. I think there is a growing recognition of the skills gap in M&E, and there are opportunities for M&E training increasingly, although some of those are sector specific, perhaps more in the HIV sector or specific to malaria or other areas. But there are M&E training opportunities out there. They're also in very high demand. But then once people are trained, it's also issues of maintaining those skills, providing ongoing support, and sort of providing networks and opportunities to share skills. I think one of the trends for M&E for the future is going to be an increased emphasis on data quality. I think we see that in some of the other fields like HIV and malaria. Those kind of initiatives are becoming more focused on data quality, and I think all fields, including the family planning field, can benefit from that. And for family planning programs, the resources may likely to become more constrained. I think monitoring and evaluation will become very important in terms of advocating for resources and in terms of really ensuring that resources are used in the most cost-effective way and are making a difference. I think too that family planning, as it becomes integrated in with other programs, the M&E is going to have to adjust to integrated environments. And one example of that being population, health and environment.